શકો છો.
Miss,
હા,
Miss,
presentation.
just
Yes, yes,
do it.
okay.
દેખાય છે?
Yes, yes, ma'am.
Now અત્યારે means window બતાવે છે કે presentation બતાવે છે?
પ્રેઝન્ટેશન નથી બતાવતું. પ્રેઝન્ટેશન હવે આવશે. તમે પ્રેઝન્ટેશન કરો હવે.
Means full screen બતાવે છે?
યસ 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 હવે ઓકે. સ્લાઇડ શો.
હવે સાઇઝ જોયો?
યસ 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 ઓકે મેમ.
બરાબર ફૂલ આવી
યસ 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 યસ
ઓકે. તો સ્ટાર્ટિંગમાં હું થોડી વાર માટે વિડીયો ઓન રાખીશ, પછી કેમેરા ઓફ કરીને ઓડિયો આપણે કન્ટિન્યુ કરશું, કારણ કે આમાં અલગથી વિન્ડો નથી દેખાતી.
ઓકે, વાંધો નહીં.
Okay?
યસ યસ ઓકે ઓકે મેમ.
હવે કન્ટિન્યુ કરવાનું છે ને કે પછી
Yes,
ફરીથી
yes.
સ્ટાર્ટ કરવાનું?
નહીં, કન્ટિન્યુ લાઈવ મેડમ. નાઉ લાઈવ.
ઓકે.
યસ મેમ. A very good afternoon to all of you. Very good afternoon to all of you. I heartily welcome you all for the national webinar organized by Department of Kaumarbhritya, GJPISR, on the topic of clinical pediatric with special reference to Kaumarbhritya. Now I invite to our professor and head, Dr. Nagesh Gangi sir, Department of Kaumarbhritya, to welcome and introduce our guest speaker of today's webinar.
Thank you, sir. Today's resource person for this webinar, Dr. Apexa Vyas. She is working as reader in the Department of Kaumarbhritya at Institute of Teaching and Research in Ayurveda, Jamnagar. Madam's education qualifications are: Madam completed BMS from Gujarat Ayurveda University, Gujarat, October 2006. And she completed MD in Kaumarbhritya from Gujarat Ayurveda University, Gujarat in July 2011. Now she is doing PhD in the subject of Kaumarbhritya. Her work experience is total 10 years, 8 months teaching experience she is having in Kaumarbhritya subject. Madam did 6 paper presentations in various platforms at various Ayurvedic institutes. Madam published 13 articles in various Ayurvedic journals, and Madam delivered 14 guest lectures at various Ayurvedic institutes, and Madam also did active participation in other activities like camps, seminar, workshops, CME, webinar, conference, COVID-19 related work, that is warrior. Then she also participated in programs like Bala Shakti, Matru Shakti and Bala Raksha. Okay. Hearty welcoming, madam. Now you continue your session.
Thank you, sir. Can we start now presentation?
Yes, ma'am.
So, today's lecture topic is clinical pediatrics with special reference to Kaumarbhritya. As we all know that Kaumarbhritya is a clinical subject in third professional BMS. The duration of 1 year. We are having theory and practical of 150 marks and 15 days training given. After graduation of BMS degree, when we are coming to practice, there are so many questions and dilemma while treating pediatric patients. So the reason behind selecting the subject is there are so many issues while handling patients successfully, like what to do, how to do, and is it okay? Even after giving the treatment, we have little bit fear about is there any harm or negative we are doing with the baby, because pediatric or Kaumarbhritya specialty branch which requires comprehensive knowledge as well as good skills with added utmost care. That means even if we are having good knowledge and skills, we have to be very careful about handling each and every patient of pediatric age. As each graduate get options like general practice, either mixed, allopathy or Ayurvedic, some chooses post-graduation and going to academics and other branches. But after becoming a doctor or Ayurvedic doctor, we encounter a number of time a child as a patient in our settings of OPD, IPD, or if we are doing job in specialty centers or tertiary cares, working in government sectors like medical officers, state government like GPSC, etc. RBSK, which is a specialized program, that is the Rashtriya Bal Swasthya Karyagram, which is mainly working for early detection and treatment of defects, that is congenital anomaly, deficiency, disease, and disability, which are mainly related with child age group. Then NRHM, and if one goes with higher education like MD, PhD, etc. But if you are a doctor, then 10 to 20% of areas that concern of a person is related with childcare or treatment of child. So now today I am highlighting the areas where which is expected in a doctor who is going to treat any of the patient, but this is minimum expected to have being skillful in this area, right? So Kaumarbhritya subjects in different classics in Charak Samhita, while describing Ashtanga Ayurveda, it is different 8 branches of Ayurveda. Kaumarbhritya is a subject which is given 6 number of sequence, while seeing Sushruta Samhita, considering Shalya is first, here Kaumarbhritya comes with the 5th sequence. When coming to Ashtanga Hridaya, as per Acharya Vagbhata, here Balagraha, that is Kaumarbhritya comes at 2nd number after Kai Chikitsa. But when we see Kashyap Samhita, which is mainly treatise related to Kaumarbhritya, here Acharya is saying Kaumarbhritya Ashtanam Tantranam Adyam Uchyate, means Kaumarbhritya is a branch which among 8 branches of Ayurveda have prime role, and that's why it is considered as a primary branch or Adya, which comes in first among consideration of 8 branches. And very beautifully Acharya defines how it is considered as a prime branch by saying Anena hi samvarditam itare chikisanti, means if a child is properly taken care and grown properly, then only a child becomes an adult, and then the role of other specialty branches comes. But if it is not properly cared, the newborn or neonate will not go into infantile age or toddler or adolescence or becoming adult. Right? So prime responsibility of a pediatrician or a doctor treating with treating pediatric branch is properly growth and development and tending to adult life. Then aim of this branch, that is Kaumarbhritya, it is not clearly written that aim of this subject, but while discussing treatment aspect, main logic behind provocating the treatment of Ayurveda in Rogadhyaya chapter in Kashyap Samhita, it is clearly mentioned that Avyahata Sharir Ayu Abhivardit Vakatham and Vikaranam Cha Shanteye. While we enter in our first year BMS, it is our first law that we remember, right? Tantrasya Prayojanam, Swasthasya Swastharakshanam, Paturasya Vikaraprashanam. So, being a Ayurvedic physician, our first role is Swasthasya Swastharakshanam and Aturasya Vikaraprashanam, right? But for Kaumarbhritya, little bit different description is available here. Here it is said that Avyahata means without any obstacle or hindrance. Avyahata Sarira Ayu Abhivardet Vakatham means a pediatrician need to look after how a child grows without any obstacle of a disease or any ailment. Then, if any disease occurs to the child, then treating those childhood disorders means Vikarana Shashtriya. Now, observing the sensitivity and significance of Kaumarbhritya branch. Responsibility of a pediatrician is clearly defined here, that one should have good knowledge of Shastra. It is good knowledge, theoretical knowledge, as well as skill. And here you can see the word Nitya Darsana means you need to have keen observation or good observation practice for successful pediatric practice. And Acharya even here described that one should not do any mistake while treating any patient. That means na aparadhanimati means it is clearly warned by Acharya that while treating a pediatric patient, there should not be ignorance or any small mistake. This shows the sensitivity of this branch. And Acharya also added that pediatrician is a very difficult job because here Acharya is saying Dushkara Japti Kurte Yujjan Sadharana Kriya means even after a simple treatment is done by pediatrician, still it is a very difficult task. It is Dushkara because in earlier time pediatrician also need to look after Garbhini and Datri also. So treatment of Garbhini and Garbha as well as mother and child. So these three persons, means pediatrician, mother and a child, they are doing very difficult tasks. Now coming to definition, Kaumarbhritya made of two words, there is Kaumar and Bhritya. Kumarasya Paranamati Kritam, Kaumar Tantra. Then Kaumarbhritya Nama Kumara Paranam, Dhatrik Shirodosix, etc. And then last Acharya Harita is defining like Garbhopakrama Vigyanam, Sutikopakravas Tatha, Balanam Rogashamani Kriya Bala Chikisitam. If we go in depth with the definition of Kaumarbhritya, we can see here Kaumaranam Bharam, Kumarabhanam means Bruti Dharana Poshana. Here Bharana means proper taking care, particularly in terms of nutrition as well as supporting the growth and development process, so that the baby is smooth transition from childhood period to adulthood. Second aspect we can see here, it's treatment. Different type of list along with Kumar Bharana like Shirodosha, Shanshodhan, Dushchaitanya Graha, disease, etc. and treating those disorders means two part here clearly defined, that is care and second is treatment. Then coming to scope or area of Ayurveda, Kaumarbhritya, Acharya Harith is clearly defining three basic areas. First is Garbhopakrama Vigyana, second is Sutikopakrama, third one is Balanam Rogashamani. Currently, these are three separate branches we can identify. Garbhopakrama means dealing with pregnancy and childcare, labor means OBS, then Sutikopakrama, gynec branch, and Balanam Rogashamani, that is modern pediatrics. Again, we can see in definition, Acharya have clearly defined the areas starting from Kumara Bharana and treating all these disorders till the age of adult. Now, coming to applied aspect, starting from preconceptional counseling to a concept of desired baby or defined baby. Okay, then Garbha Sanskara, fetal medicine, and child age ranging from newborn to adolescence. See, apart from different branches, we have different age group, and accordingly we need to take care of that age group child. Starting from newborn to neonate, then early, middle, late childhood, adolescence. Earlier, it was considered that up to 16 years of age, patient or person is considered pediatric patient. But latest two observation is a little bit different. It was extended up to 19 years as per one research article. And current, in the reference of April 2022 by FDNC Federal, it was considered that a person up to 20 years of age is considered as pediatric patient. Now coming to main areas, practical areas with which we can implement our knowledge in clinical practice. Okay. So Kaumarbhritya, we have to take home message like two areas. First is dealing with childcare and second is treatment of pediatric disorders. First we'll see what are the areas which are coming in childcare. So first is growth and development. Irrespective of the practice you are doing, but when a patient of pediatric age group come to you, you must have basic ideas regarding growth parameters, developmental milestone, nutritional status, and we need to promote breastfeeding and particularly exclusive breastfeeding. We know that in Kaumarbhritya and Ayurveda, excessive importance is given to breast milk, matrustanya, and we can see the concept of Dhatri itself suggests the need or necessity of breast milk in the newborn, and it was well understood by our acharyas. Then dentitional disorders and dentition regarding information. These are the small certain questions which are related to health or disease, which will frequently asked by your relative once you become doctor, either your neighbors or family members. So these are the area and little information with clear information and idea about this point. You must carry with you. Then coming to vaccination, Suvarna Prashan, Garbha Sanskara, and childhood sanskar, preventive measures and immunity boosting measures, health promoting measures, and emphasizing healthy lifestyle adoption since childhood period. Along with these, when you are doing your clinical practice, you need to have good observation. So with your good observation, you are likely to elicit some cases like developmental delays, cerebral palsy, many syndromes, disability disorders, etc. Because these are the area where early identification and early intervention will work very nicely. So being along with good at your clinical practice, it should be kept in your mind that appropriate referral at appropriate place and appropriate time is ideal for patient. Now, after childcare, coming to treatment part. Treatment again, we need to divide for our easy understanding. Treatment of neonatal disorders and treatment of childhood disorders. Now, as we know, neonate is a period of up to 28 days or 4 weeks. So any disturbances or any abnormality during this period, you should consider as neonatal disorders or disease. Again, it is remarkable that obstetrician doctor or doctors doing obst practice plays a major role to minimize the number of neonatal disorders. So if we are doing a particular practice of gynecology, so if little consideration is given towards neonatal health care, then it helps a lot. See, this is the list of neonatal problems like infection, prematurity, genital anomalies, respiratory disorders, etc. And these are the list of neonatal mortality. And we can see here low birth weight, prematurity, any birth injuries, diarrheal disorders, diseases, and respiratory disorders or infections are contributing a lot in neonatal mortality. Then postnatal again, list are given on slide. Now coming to this data, you can see here, preterm is considering contributing 35% of death, neonatal death, means a death within 28 days of life. Okay, just imagine the first percentage of preterm and its related complication leading to death of a baby. So if we are doing good practice, particularly good gynec practice, and doing Garbha Sanskar, etc., like preventive measures from Ayurveda side, we are contributing here. And this 35% is a great loss to any of the country, right? So our beneficiary efforts are considered as positive remarks in society. Then you can see here intrapartum related complications. Again, careful handling during delivery will decrease the percentage of this neonatal death. Again, we can see here diarrhea and pneumonia and other infections. If we are able to decrease the number, it's a considerable improvement from our side to the society. Now this is the area when we can intervene. First area or first primary intervention area comes when the mother is pregnant. If we are taking good care of mother and handling all these Garbhini Paricharya, etc., then it is definitely giving good result of neonatal morbidities, means disease of neonate. So if we are emphasizing on proper care of a mother during pregnancy, then it is obviously that we are getting positive result in neonate. But if any disease in the secondary intervention, if any disease are observed in neonate, then prompt and effective management during this neonatal period will lead to decrease the number of neonatal death. Means successful handling of neonatal disorders will lead to positive outcome by decreasing the number of neonatal deaths. So these are the areas we can do from prevention side. Ultimately, what we have learned earlier, that is to aim Vyahata Sharir Ayu Abhivartate Vakatham and Vikaranam Sushanti. Means if we are doing prevention, isn't it a smarter way of treatment? Because there are some disorders which are not having any specific treatment, and the baby goes to either morbidity or mortality. After neonatal disorders, we come into childhood disorders. This is the list of common childhood disorders frequently encountered in pediatric OPD, like most of our respiratory disorders, common cold, bronchitis, then chickenpox, skin conditions, allergic disorders, etc. Again, percentage or data regarding under 5 deaths, means death of children before celebrating their 5th birthday. And you can see here the number or percentage of the death. Here 41% of contribution is given by only newborn death. Again, so by preventing preterm birth, neonatal mortality and low birth weight, we are doing a great work towards the society. And remaining 59% of children death, here you can see diarrhea, pneumonia, other infection, and non-communicable disorders. These are the areas or diseases where again Ayurveda is doing very well and we can do a lot. So by just being a more vigilant practitioner, we can contribute significantly as a health professional by decreasing this number. Now, for simplification of implementation of the treatment, I have managed like this. So, in general, what are the types of disease? Okay, when we become a doctor, our first role is treating the disease. Okay, so what is the disease? Broadly, disease can be categorized in 4 types. That is genetic, biological, physical, and chemical. Okay. Genetic, all we know, caused by gene abnormality, and these are the examples of genetic disorders like Down syndrome, muscular dystrophy, thalassemia, etc. Congenital disorders again, mainly due to genetic mutations and some of the factors during intrauterine life, and generally surgical intervention is required for this. Second category is biological. Biological means biological agent is responsible for creating the disease, and list of biological disorders, as we all know, infectious diseases like bacteria, virus, protozoa, fungus, and helminths. I have prepared another type of disease. Here you can say first is infection, and biological means biology is responsible, right? So as per Ayurvedic classic, one type of disease is Nija. If we are considering Agantu Vyadhi as an infectious disorder, then another group of disorder is termed as Nija Vyadhi. So when a person's individual physiology is responsible to create a disease, and list of such diseases are lifestyle disorders, all the lifestyle disorders which are considered as Apatya Nimitach Vyadhi or Pragya Paradhaj Vyadhi. Then all the non-communicable disorders, autoimmune disorders, all this type of allergies, even dentitional disorders comes under this category. Third type of disease is physical. When any particular physical injury is responsible for creating the disease, like any injury during the time of birth, like forceps or any instrumental delivery, will lead to injury in nerve brachial plexus, leading to Ops palsy, so burns, sunstroke, HIE, etc. And fourth category is chemical. Any drug reaction, poisoning, and chemical reactions, and main important resistance to drug or antibiotic. Nowadays, many cases are coming with us with antibiotic resistance when antibiotic is not giving sufficient result in particular disease condition, and they come to Ayurveda. Now coming to treatment part, all we know treatment is all these measures which are aimed to treating the disease or disease destroying approaches. Okay, we have to consider here prime importance of Shuddha Chikitsa, means we are treating one disease but it doesn't cause any harm or doesn't do any side effect or adverse effect to the body of the patient, right? So again, type of treatment is divided practically in three categories. First is preventive, means prevention have major role here in the categories where there is no specific treatment is available for particular disease type. See, we have done so many progress in terms of advancement in technology and modern medicine, in science, but there are certain number of disorders which are having no any clear treatment and no any definite management protocol even. So preventive is the best option we can offer, so that can be are doing less suffering of the patient. Second is curative, where we are providing very good or satisfactory treatment, and we are treating the disease from the root. Means after giving particular treatment of particular disease, patient need not any treatment as a continuation treatment, either modern or Ayurvedic. That we can say we have cured 100%, right? And the third category is adjuvant, or we can say supportive or palliative or maintenance care or maintenance treatment. There are certain group of disorders where 100% of reversal of pathology is not possible from any of the pathy. And Ayurvedic treatment is not aimed here for curing the disease, but it helps to prevent further progress and complication. And by this, it helps to improve quality of life of patient. So we see here preventive treatment part. Prevention of congenital disorders and genetic disorders by following proper Garbha Sanskar method. Okay. When we study congenital and genetic disorders and we see in practice, day by day increase or considerable increase is observed in such disorders. Okay. We can't do much help to that patient, but by preventing we can have some positive result on decreasing the incidence. And this also includes taking proper care of health of adults and girls who is going to be a mother in future after a few years. Okay. Then choice of partner for marriage, likewise thalassemia. We are doing testing and thus preventing so many genetic disorders. Then preconceptional counseling. Before planning of progeny, there are particular dictums to be followed by both the partners for the well-being of future baby. Then taking proper care during pregnancy, antenatal care or Garbhini Paricharya. These all are having very significant and great result, beneficial side towards the incidence of such disease. Now prevention of infectious disease by increasing immunity, by using immunomodulated drugs and Lehana, Swarnaprashana and Sabrasayana drugs. And even it is also described in classics how to stop the spread of infection when there is infectious diseases on spread, okay, like Rakshakarma and Thupana. Prevention of lifestyle disorders. Here, role of Pathya and Sattavajik comes first. By following proper Dincharya, Rutucharya and particular do and don'ts and some conducts and behavioral changes, we have to advise a child or a patient to make healthy lifestyle as a first choice. And some examples like preventing outside or packet food. We can't stop 100%, but we advise them to have minimized portion of that food. Then excessive use of mobile, TV, and electronic gadgets, and some discipline should be followed. We can't deny to use these all around the gadgets, but we have to inspire them to have some discipline to be developed for using this thing. Then promoting breastfeeding, because exclusive breastfeeding is very important, and we should not advocate any artificial or food preparations which are in market. Okay, by this we are preventing number of GI disorders of a newborn, and which consequences leading to neonatal morbidity and mortality even. Again, starting from newborn age, Abhyanga, bath, etc. Ayurvedic dincharya should be advised for healthy lifestyle measures. Again, for a child to be grown in proper environment is also important, because nowadays so many psychological disorders are observed in early age. For example, 10 to 12 years of child is doing antisocial activities, trying to suicide and bulla and beating her parents, destroying some things, etc., etc. If we have developed such discipline to not to indulge in such activities, it's a smarter way, right? So we can prevent such disorders before they appears in the person. Now coming to curative treatment. In these areas, Ayurveda is giving very nice or satisfactory result. And first come here respiratory disorders. All the recurrent infections, patients, the common cold, bronchitis, asthma, tonsillitis, etc. Then all the skin disorders, GI. Again, this is the area. Some of the patient get very good result, and they don't need to continue further with treatment even. So for that we can consider here curative, and some of will come on palliative care. So it depends on the condition and severity of the patient as well as the disease. Even in newborn and early infantile period, we are giving very good result in digestive problem, respiratory disorders, jaundice, eye and umbilical conditions. Now third category is adjuvant or palliative treatment. Here, this is the area when we are not treating the disorders or disease by the root, okay, but with our treatment along with modern medication, we are providing very good result in terms of subsiding the side effect of modern medications and improve the quality of life. For example, thalassemia is a condition where frequent blood transfusion is required, right? It is observed in many research studies which is conducted in ITRA that if a patient is required blood transfusion every 15 days, then after giving treatment of Ayurvedic formulations, the duration of blood transfusion is prolonged. Even liver protection is observed as an effect of Ayurvedic treatment. Right? And some of the symptoms like fatigue, anorexia, body ache, it is frequently observed by the patient of thalassemia, which are easily removed with the treatment of Ayurveda. So along with BT and other modern medication, Ayurvedic treatment, if it is continued along with, then it is very beneficial for the patient. Again, second category is muscular dystrophies. The prognosis is very poor for these muscular dystrophies. We are not again changing the prognosis or treating the disease, but with vigorous and continuous treatment, particularly Panchakarma therapies, we are helping the patient to increase little bit lifespan and delaying the complications like respiratory failure and complete immobility. And improvement is observed in motor function particularly, and thus improving the quality of life. in mental retardation also. Same, Down syndrome is a genetic disorder. We are not changing any conditions at gene level as well as in the facial features or other structural symptoms, right? But there are some associated symptoms which are frequently observed in Down syndrome patients, like the patient with Down syndrome getting recurrent RS infection, and that's why need of frequent antibiotic and modern medications, and GI disturbance and other disorders like dental caries, etc. So with Ayurvedic medicines, we are going good relief in these symptoms. Now this is the most important area or take-home message, like part of this session. While treating pediatric patient, there are certain rules or lines we have to keep in mind. And first is think first normal. When you become a doctor and start your clinic, or when we are used to sitting in an OPD and doing clinical practice, it is our mind that patient is coming to us and we have to give a medicine. But for pediatric age group, it is not necessary, because not every patient coming to you need your treatment. 20 to 30% of the patient need your counseling, because there are chances of the condition to behave physiological. So before reaching to any final diagnosis, you have to consider exclusion of this physiological condition. For example, if baby comes at the age of 4 months or 3 months, the parents will say baby is having loose motion or diarrhea, and you are giving treatment of diarrhea. But before labeling the disease, you have to see what is the age of patient. Patient is doing breastfeeding, and for breastfeeding, it is normal that patient can pass ball 8 to 10 times, even 12 times. But other parameters along with this defecation frequency should be normal. Then there is no need to give treatment. You just need to assure the patient and explain the condition. Even if you have to see, if the age is around 6, then you have to look after it. Is there any teeth eruption in the baby? So the diarrhea might be due to teething. So associated advice should be given with the treatment part. If you are dealing with childcare or doing pediatric practice, then it is very much needed that you must have good knowledge of modern pediatrics, right? Because number of disease, number of syndromes are encountered in our OPD. So before labeling or diagnosing any disease, particular from Ayurvedic side, we have to be clear for differential diagnosis as well from modern side. Counseling is the heart of pediatric practice. Dislike other departments or other branches, they have to deal with patient and patient mother, father, sometimes other family members also. And we have to counsel properly regarding the problem of a baby, because in a family, one child is right now 10, okay, and we can see the number of IVF and test tube babies increasing. So any problem or any issue of the baby or a child, it is a great problem for the family. So we have to consider the psychological condition and stress of the family also. And don't take the responsibility or claim to treat where some doubt or uncertainty is there. Most of the time, some doctors are taking a risk. Okay, this might be because of this and treating them. But for pediatric patients, we should never take a chance. And very alert about giving Rashoshadi, which is containing Rasasastra drugs like Vish, Opis, etc. Just example like Shankhavati, when you used to be in clinical practice, Shankhavati is a frequently prescribed drug, but we have to search regarding its content, like Parida, Vasanap and Gandak are in the content list, right? So unless and until is it important to give the baby, and first aid advice, when there is herbal preparation is available for that, we should not go directly with the Rashoshadis. Then most important aspect is not to interfere with the modern medications, particularly anti-epileptic drugs, anti-diabetic drugs, and anti-hypertensive drugs, because it is better for us, or particularly we can say safe practice while treating a pediatric age group patient, because these are the drugs which have many withdrawal symptoms and exaggerated symptoms if their dose is tapered or stopped. So better to send or refer to a particular doctor who has started the medicine. Then ignoring any of the serious conditions or small complications like situation, it will give negative to the patient. So we should be very vigilant while doing pediatric practice. Sometimes it is necessary to clear the prognosis, like muscular dystrophy patient, or this is my patient. We are not treating the condition, and what is the prognosis we learn theoretically. We should explain in a positive manner, so patient as well get prepared for the treatment and become positive for the treatment aspect. Again, for newborn area, we should be alert regarding this alarming sign for checking the nutrition level, any neurological conditions is present or not, any dysmorphism, any congenital deformities, and developmental abnormalities. For example, if a newborn baby or a small baby is coming to your clinic and you see a small tag or some abnormal facial features, then you should have some click and you should not ignore it. You should ask further investigation if patient is having, or sending to a pediatrician or a specialist for further investigation and ruling out any another disease is present in the baby or not. So the baby gets proper treatment at proper age. This is the list of common childhood disorders which are observed in Ayurvedic practice. Krimi, Pratishyai, all RS disorders like cough, swas, etc. This is the list of drugs which are giving very good result in particular system disorders. We are not going in depth. Now, coming to last part, that is Panchakarma procedures in pediatric patient. Panchakarma procedures or Panchakarma itself a little bit controversial point while it is advocated in pediatric patient. So while doing Panchakarma in pediatric patient, we have to be very, very careful. We have seen that there are 5 procedures which are labeled as Panchakarma, and Snehana and Swedana and Deepan Pachan is a Purvakarma. Snehana and Swedan, though it is
No, previous ma'am, previous. Yes, no. Yes, ma'am. From this side. Yes.
As we all know, Ayurvedic is having 2 types of treatment. One is Saman and second one is Shodhana. In Shodhana, different purification methods are done, and this Panchakarma holds 5 main procedures, and there are Purva Karma like Snehana, Swedana, and Deepana. While we are dealing with pediatric age group, Snehana and Swedana, though they are Purva Karma, but it is very effective when it is applied as Pradhana Karma. First is Snehana. There are 2 types of Snehana, it is Bahya and Abhyantara. Frequently, we are using Bahya in terms of Sarvanga Abhyanga or Sthanik Abhyanga. While it comes to Abhyantara Snepan, it is only recommended with the patient of age more than 10 years, and it is make sure that the patient is capable of following your instruction of Abhyantara Snepan. It is again effective in SWAS and chronic skin disorders. Coming to Swedana, there are different types of Swedana which are prescribed in pediatric age group. Nadi Swedana, Cystic Shalipinda Sweda, Valuka Sweda, Patrapinda Sweda, Atap Sevan even giving good result. Though it is Niragni type of Swedana and it is not in practice, because we understand what is the use of Atap Sevan. Though it is non-pharmacological type, but it is giving very good result. Then Vastra Sweda. Then coming to Basti, different type of Basti is also prescribed for pediatric disorders. Matra Basti, then Yog, Kal, and Karma Basti in terms of Anuvashan and Asthavana. Veteran Basti in condition of Amvata, juvenile idiopathic arthritis, and Chaturpadra Kalpasti. Then procedures of Vamana. It is only advised when the patient again is capable of following the instruction, and physical strength is good enough, and the condition again itself indicated for Vamana, like chronic skin condition. Some modification, Mrudu and Satya variation is advised using medicines like Aravat Palmacha, Trivrit Churna, Trivrit Leha, Iron Tela, Iron Drugs, Haritaka, etc. Coming to Nasya, mainly two types of Nasya are there, Marsha and Pratimarsha, but for pediatric age group, Pratimarsha Nasya is more advisable. Then last one is Raktamoksha. Again here, bleach application is given priority, Chalokavacharan in skin condition, and if required, we can do Prashan also. Here last, there are some photographs of my patient in which I can see the result. You can see very good improvement, short time period. He is a baby of 11-12 days, and he developed this type of pustules, and the treatment was given. And this is a photograph of 2nd June. After 1 week, when the patient came for follow-up, the blisters, the pustules was completely disappears. And when I asked when you get result or when these pustules were skin lesions were disappeared, the patient replied only 2 days. So starting from 2nd June, within 3 days, his skin condition was completely resolved. This is the second case of abscess at scalp area. First photograph is missed with me, so it's after 4 to 5 days of internal medication as well as local application. It is approx 50% decrease in size, 40 to 50% decrease in. This is the second visit after 4 days, and after 1 week, means after 12. Dr. Sagar, my dear students and scholars, and all the teachers of Ayurveda and Ayurveda science even. And thank you all, the audience, for sparing your valuable time for this session.
Thank you so much, ma'am, for these informative lectures and spending valuable time with us. Now, we shall go begin with question and answer sessions. Madam, we have some questions for you. First question is, what we can do in preconception counseling in Ayurveda?
When it comes to preconception, generally it goes with SRPT or gynecology department, but for preconception we have to first create awareness, and for creating awareness we have to show the future with the current statistic, right? So by observing the statistic like rate of infertility, right? So many couples are taking treatment of infertility, hormonal treatment, and even if after not getting the proper result, they go for IVF and test tube babies. So first thing, we have to make aware the current scenario. Second thing, the incidence of congenital anomalies and so many disorders which have long-term and short-term consequences which are not good for the future generation, like Down syndrome or cerebral palsy or even diabetes, thalassemia. There are a number of disorders when we come to pediatric OPD or any big hospital. So it is little bit worrisome that observing the incidents, each and every patient is having some possibility about the chances that their baby gets affected with these and these, right? So it is better to take care starting from pre-conceptional age.
Okay. Thank you, ma'am. And ma'am, second question is from your interested area. How to treat cerebral palsy child? And is there any particular protocol to treat these types of patients? And is there any medicines for cerebral palsy and other disorders?
Okay. I I can just answer briefly because this is a very large question will need my elaboration. First of all, CP is a condition when modern medication is not doing complete treatment, right? Or 100% relief patient does not getting. Again, it is a condition where multidisciplinary approach is required. Means along with Ayurvedic treatment, you need to have help of physiotherapist, speech therapist, occupational therapist, etc. So first thing is only internal medication is not sufficient. First thing for treating the cerebral palsy. Second, Panchakarma have significant role for treating or managing cerebral palsy. Second thing, while we are doing Panchakarma, first we have to make sure that we are sufficient or good enough to have experience for this Panchakarma procedures in pediatric age group. Because what happens, I think a lot of disturbance is there. Because we are doing busting, but we are not sure which dose is given advisable to the patient. Sometimes we are not much qualified by doing Abhyang and Svedana. So sometimes burns or extra burden to the patient we are doing. In spite of doing benefit, we are doing harm to the baby. So if you are well qualified and experienced for the Panchakarma procedures, then we should definitely go for Panchakarma treatment. When we are talking about internal medications, number of Grita preparations are mentioned in classics, which are doing very good result in improving brain functions, speech, and motor functions even, like Samvardhana Grita, Kalyanaka Grita, Panchagavya Grita, etc. For Panchakarma procedures, I prefer Abhyanga with medicated oil, different type of Svedana in terms of Nadi Svedana, Cystic Shali Svedana, Patrapinda Svedana, but sometimes Udvartana and Udgarshan. All these procedures are giving very good result. Now, talking to protocol, I don't think protocol or sticking to any particular protocol will give good result. With the experience of number of patients, I have experienced that flexibility in the treatment protocol is the good factor which is giving good result to the patient. So first we have to see, okay, with this protocol, patient is getting good result, then we have to go for this. Despite this 15 days, 10 days, or this and this combination of procedures with the patient or CP.
Thank you, ma'am. I also read your book, madam. This cerebral palsy Samjuti, Samanya Samjuti. This book you written by you. It is awesome and very aware for people and some cerebral cerebral palsy children's. So thank you, madam. There is much more questions for you, but we will discuss after next seminar and next time. Now I request to our HOD sir for vote of thanks.
Hello. Uh, Now we will conclude the webinar session. So, behalf of Department of Kaumarbhritya, G.J. Patel Institute of Ayurvedic Studies and Research, I would like to extend sincere thanks to Charutara Vidya Mandal for their wholehearted support in conducting such activities. I would like to extend my thanks to CVM University for granting permission for webinar. I would like to extend sincere thanks to Honorable Chairman Sir, Shri Engineer Bhikkhubhai Patel Sir, Charutara Vidya Mandal for accepting our invitation and gracing this occasion by his presence. I thankful our respected Director Sir, GJP IASR Professor Dr. C.H. Babaria Sir, his constant support and guidance in successfully carrying out this webinar and also encouraging students' energetic activities. I would like to extend my thanks to today's webinar guest speaker Dr. Apexa Vyas Madam for her informative session and given valuable time. I would like to thank Engineer Mir Bhai Patel for his technical support and extension cell members for giving platform to organize this webinar. On this occasion, I would like to thank all the faculty members for their active participation and conducting this webinar. Also, I would like to extend my thanks towards students for showing their presence and for their patience listening. All the staff who were directly or indirectly involved in making this function successful. Once again, thank you one and all.
Thanks.
Okay, once again, thank you, madam.